CT or MRI is the best. They can detect most of the brain tumors present. But don't get worried, all headache, seizure or vomiting is not brain tumor. I'm Dr. Vipul Gupta, neurointerventional surgeon. On this event of Brain Tumor Day, I would like to tell you about brain tumors. Now, tumor is something when the tissue starts to grow, cells start to grow even when we don't need them to do so. And brain tumor or tumors in the brain, including brain and bone to the spine, they are quite common, one of the common diseases which affects the brain. Tumors can be of two kinds. One is benign and malignant. Benign means they grow locally, they don't invade the tissue, they don't spread elsewhere in the body, and if removed, patient is cured. So many brain tumors are benign. And then there are malignant tumors. Malignant tumors means the cells, they keep growing and it's not difficult to stop them and even difficult to remove them, and they can spread in different parts of the brain as well as other parts of the body. So what is the treatment for brain tumors? Brain tumors are usually treated by neurosurgeons. A neurosurgeon will completely assess the patient as well as the imaging, what the radiologist have reported. Many of these tumors are treated by open brain surgery. I know open brain surgery can be very frightening, but in the current era, neurosurgeons can use image guidance, CT or MR imaging guidance. That means when they are operating, they precisely know where they are and they can avoid injury to the normal brain. There are other methods also which they can use to prevent injury to the brain, and brain injury over the time has become quite safe in the brain tumor. As I said, benign tumors can be removed completely, but in some tumors, if they think brain can get too damaged, they may not remove it completely for the safety or sake of the patient. Biopsy of the pathologist sees the tissues after the surgery and they try to judge what kind of brain tumor it is, and then patient may need further treatment. If the biopsy shows that patient has malignant brain tumor and if the surgeon doesn't feel they removed it completely, many of the malignant tumors may need further treatment such as radiotherapy and chemotherapy and long-term follow-up to see if the tumor is coming back or not. So that is very, very important to complete the treatment on beyond follow-up of these patients. Other method is radiosurgery, in which cyber knife or gamma knife is used for benign tumors, which has come as a big boon. Many small benign tumors nowadays can be treated quite safely by using radiosurgical techniques used by the neurosurgeon and radiotherapist. So what are the signs and symptoms of brain tumor? How can anybody even suspect that person may be having brain tumors? Signs and symptoms can be non-specific. It can overlap with other brain disorders. One of the most common is headaches, because tumor starts to grow, it creates a pressure. Patient can have seizures or the epilepsy, as we say. Patients may also develop weakness of one side of the body because tumor affects the cells of the brain. Person may develop vomiting along with the headaches, and sometimes when brain tumors grow too much and cause a lot of pressure, patients can even become unconscious in these cases. So any symptom, patient should go to a neurologist or a neurosurgeon, and CT or MRI is the best. They can detect most of the brain tumors present. But don't get worried, all headache, seizure or vomiting is not brain tumor. Most of these cases are other medical cases.